All right, so today we're going to talk about the common conditions for post-delivery mummies. And actually, there's top 4 conditions that we have. So the first will be low back pain, the second will be dyslexia recti, the third will be carpal tunnel syndrome, and lastly, the Decompression syndrome. So I know there's a lot of medical terms here, but don't worry, we'll go through it later. So we go through one by one. The first will be low back pain. So actually, low back pain is very, very common among prenatal and postnatal pregnancy concerns, but it is treatable with physical therapy, which is physiotherapy. So Susan George, she is the director of Women's Rehab and Men's Health UPMC, once said 90% of women experience low back pain during pregnancy, and almost 75% of women report having low back pain after delivery. So that's mean low back pain is super common for post-delivery mummies. And actually, how can this happen and what caused this? All right.
I guess that's why people think it's normal, because it's like the most common thing. And
It's
because
so
even
common.
before you give birth also, you probably already have back pains, lower back pain as well.
Yeah. Especially nowadays, people tend to do in prolonged sitting. They do the desk work a lot. Yeah. So
Yeah.
there are top 4 common causes for mothers to have low back pain. The first will be hormonal changes. The second will be the technique you leave or you carry your baby. The third will be the posture when you breastfeed your baby. And lastly will be the effect of anesthesia. So what happens to hormonal changes is during pregnancy, our body will automatically release a hormone. It's called relaxin hormone. So this hormone is aimed to loosen up all our joints, ligaments, tissues, everything to assist in childbirth. So you imagine yourself, your muscle is being stretched out more and more for 9 months plus to make space for the baby inside. Definitely the muscle become weak. So all these abdominal muscles and the back muscles, it's aimed to support your spine, especially to maintain an upright positions. So if you're in a prolonged positions like prolonged sitting, prolonged standing, because the muscle is weak, you start to have pain. So this is also a signal of your body to give you like your muscle is very weak, that you cannot tahan. So you might more prone to injure yourself. So hormonal changes actually is the most common cause that mummies will have low back pain.
Wow, I did not know that.
Yeah, it's a normal like side effect I would say.
Okay.
Yeah. So the second one will be the technique you carry your baby. So I believe of a lot of mother, they tend to bend their trunk forward to reach up for their babies, and some they twist their trunk to pass their baby, or they put their baby in the car seat. But actually, this is too big no that you should not do. So what you should do is you always use your knees, then your back. Use your knees and your back. So for example, if you want to carry your baby from the crib, first you lower down the side of the crib, then you squat down, bring the baby close to your chest, then stand up. So don't just bend, carry your baby like that. You twist your back easily. And then if you want to pass your baby to someone else, if you want to change the directions, always take a small step towards the directions, then your upper body follow the directions. Only then you pass lah. Right? So the 2 big no, which is do not twist your trunk and do not bend your trunk. So these are the do's and don'ts lah. You can snap a photo if you want. So always squat down or use a small step to change directions. This is most of the mummies have the low back pain because they like tend to use their back in an incorrect way lah.
So little changes actually make a difference, yeah?
Yes, definitely. Always use your knees lah. Your knees is stronger than your back.
Definitely, for sure.
All right. So next will be the technique you breastfeed your baby. So for this one, the things you should avoid is same as what you should not do in the lifting, which is you do not bend your trunk or do not twist your trunk. So what you should do, for example, if you're breastfeeding your baby, always sit with back supported and arm supported. So sit with a chair with back supported, put a pillow on your thigh, then rest your arm and the baby on the pillow lah. So by doing this, you prevent shrugging your shoulder, leaning towards your baby, and which might cause you to have neck pain, back pain, and like soreness of your arms. So maintain a good posture can relax all your shoulders and prevent you to have more complications. All right. So there are so do's and don'ts here. Same thing lah. You can snap a photo. Do not bend your trunk or twist your trunk. Always sit with back supported and arms supported. All right. So the last common cause of having low back pain is effect of anesthesia. So anesthesia actually is the injections that the doctor inject to your body near your spine.
So we're talking about things like epidurals, right?
Yes, yes. It's to prepare for C-section. So this only happens among C-section mummies lah. Okay. So what this happens is some mummies, because of the injections, they will cause muscle spasms around the spine area.
Okay.
Yeah. So what is muscle spasm? It's the muscle that tense up and cause you to have pain. Very painful lah when you tap.
Wow. Okay.
So this muscle spasm can lead like days, months, days, weeks to months. So leading you have low back pain lah. But it's not for every mummy lah. Some C-section mummies say okay with it, but some they have the effect of muscle spasm.
Okay.
So
I'm intrigued by the fact that it can the spasm can continue like for weeks and months after delivery.
Yeah,
Wow.
it cannot individual lah. Some mummies very okay when they after that they no feeling, but some no. Yeah.
Okay. All right.
Okay, so this is the top 4 common causes for low back pain lah, which is hormonal changes, the technique you leave, and the posture you breastfeed your baby, and the effect of anesthesia.
All right.
Right, so now we move on to the second common conditions, which is diastasis recti.
For a while that I'm a bit lost, but yeah, Xian will walk us through this.
Okay, so this one, it's happens in connective tissues called linea alba. So Mac, do you know where is linea alba?
I have no clue.
All right, actually it's the midline of your 6-pack here.
Oh, okay.
Called linea alba. So what happens in diastasis recti is this connective tissue thins out and widen up in response to the hormonal changes, like what we say just now lah. All the muscles, tissues here being stretched out too much, and so this tissue also being stretched and thins out. So to accommodate the enlarging uterus lah.
Okay.
So, but usually the relaxing hormones in our body will remain up to 8 weeks after delivery. So that means the effects still acting in your body up to 8 weeks. But after that, when the relaxing hormones subsided, all your muscles, tissue should regain its strength and the elasticity. But some other don't. So maybe their linea alba is being stretched out too much that it lost its elasticity. So you become like a longkang over here. You see, yeah. It's like, yeah. But some mummy will have bulge out instead of longkang lah.
Yeah.
Like you're still having baby inside like that.
Okay.
Either way. So actually, who is at high risk of having diastasis recti will be the mummies that having multiple babies. Like you have twins or triples. Definitely the size is bigger, then your muscles, everything
stretches more.
Yeah. The second, if you have multiple pregnancy, like this your 3rd or your 4th child. So if every time after delivery you didn't follow by a proper rehab and your muscle is being stretched and weak, so you yourself you don't know lah, but the muscle is weaker and weaker every time you're pregnant, so I'm more prone to have injury. And lastly is the mother start to exercise too early.
Okay.
So it's
post-pregnancy.
Yes. So some mother they want to maintain like in a good shape after delivery, that start too early lah, the exercise. Especially like sit up, plank, crunches, all these things you should not do, because when you do sit up, you're actually strengthening your 6-pack, right? So when you strengthen this 6-pack, all these muscles will become tense up and shorten. So when the muscle shorten, you pull even more, pull the linea alba apart.
Oh,
That's why
wow.
it's widening lah, furthermore lah. So
In that case, how long before you can actually start exercising? I mean, for moms who are actually very concerned about how, getting back into shape in their figure and stuff like that, right? So to avoid this from happening, how long before you can actually start
actually, it depends on the type of delivery.
recovery?
You are normal birth or you are C-sections. Usually,
Okay,
C-section mummies recover longer time,
longer.
like 6 to 8 weeks,
Mm.
because they have wound ma. Right? So, but there are some exercises that you can perform even right after giving birth. But this exercise, you should consult a physiotherapy or some teachers that help postnatal class up there. They know what should do, what should not do lah.
Okay,
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 but crunches, sit up, plank should not do. It's a big no. Cannot do. All right.
okay.
So yeah, this is our normal abdomen, which you see this midline thing. It's a linear alba. So in the accessory recti, it's become like this. So separation of the abdominal wall, you see is widened up. So there are few type, either in the middle, down, up, or all along. Okay. And there are few signs and symptoms. I know it's a lot, but I just go through lah, huh?
Yes.
So the first will be if like bulge or ridge that runs down the middle of the abdomen, and it's very obvious when you engage your abs. It also might lead you to have low back pain. Why is because when the separation of the abdominal wall happens, it will reduce the support in the front of the core. So you're putting more stress on your back lah to compensate. So for sometimes your back will become pain lah, because it's too much lah, the stress. And because of the separation of the abdominal wall, definitely your muscle will weak lah. Difficulty in lifting, difficulty in performing poor posture, constipations, bloating, and heaviness in your pelvic floor.
Okay.
Okay.
All right. So I'm just going to stop Xian here for a little moment. I see quite a number of you actually raising your hands. If you actually have a question this evening, you are welcome, more than welcome, to actually type it in the chat box below so that our back end support will collect all your questions and then we will address all of them at the end of Xian's session. Okay. So that way we can ask all the questions, she can clear it out for us, and we will have a very smooth presentation this evening. All right, Xian, back to you.
Okay, so this is the second conditions lah. And now we have a small test that I would like all the participants that you can do with me, together with me and Mac. So this is the test to test whether you have diastasis recti or not. So if you are convenient to test, you can lie on the yoga mat or on your bed itself, lying flat with both of your knee bent. All right? Okay. So yeah, get ready first. Right. So after
we're
that,
going to give you enough time to actually, if you actually have the convenience of lying down right now and doing that. So lie down with your knee bent flat. Lie down with your knee bent. Sorry.
knee flat.
Okay, Xian, go ahead.
Okay. So then you place one hand above your belly button, the other hand under your head.
Okay.
So the hands that place above your belly button should be perpendicular to the midline, the linear alba, the midline. Yes.
Okay. Perpendicular. Okay.
Like, yeah, like that. And then perpendicular, place above your belly button. Then this is the starting positions lah, huh?
Okay.
So after that, you can try to sink in a little bit, sink in your fingers, and you try to feel the tensions there. You should feel the tensions that the muscle is wrapping around your fingers. So now, try to breathe in through your nose and breathe out through your mouth while lifting up your head about 1 or 2 inches off the ground. Then try to sink your finger in even more. Okay, so when you sink your finger even more, you can test how many fingers you can sink in. It's actually considered severity of your diastasis recti lah.
How many fingers you can sink in? Okay.
Like how many fingers width lah?
Width. Okay, width. All right.
So the positive result is you have 2 fingers and above, you consider having dissection recti.
Okay.
So for this, we test above your belly button, but later you can try on different level, like what we explained before, because there are 4 types. So we can test above belly button, below belly button, below the sternum to test each level, see which dissection recti you have.
Okay.
Okay, so usually 2 fingers and above consider positive. But if there is mothers that just right after deliver, you definitely will have positive result. Don't worry, it's because your hormone is still acting on your body. All the muscles and connective tissue still in very lax positions. So definitely you have positive result. So I would suggest to start test after 6 weeks, after 6 to 8 weeks. Then you will get a more correct result for you lah. For now, definitely you have positive.
Okay.
All right. So if you found you're positive, don't worry, you can consult a doctor or the physiotherapist. They will do what they can do for you lah. They will do the needful lah.
So it can be corrected, correct?
Yes, it can be corrected.
Okay, so it's not like, this is, the end of everything, but it can be
No.
corrected. There are specialists out there who can help you correct the condition.
Yes.
Okay.
All right. Okay. So don't worry, you can go and find a physio or find a doctor lah. Okay. So next we go to carpal tunnel syndrome. This is also a very, very common condition for mummies. So what's
postnatal, is it really?
Yes. Usually during pregnancy, but even postnatal, that can happen.
Okay.
Okay. So during pregnancy, mothers wrist will swell up because they tend to have swelling all around during pregnancy. So all this swelling, when they at your wrist, they might compress the nerve underneath. It's over here lah.
Okay.
So the median nerve, when the nerve gonna impinge, you have nerve symptoms like numbness, tingling, burning sensations on your fingers and your palm.
Okay.
And somehow you might have wrist pain also. This is how carpal tunnel syndrome happens lah. And for some mummies, if they are working mummies, they do a lot of desk work, like typing a lot. They might also have carpal tunnel syndrome because overuse of the wrist might putting stress on the nerve also.
Yep.
So this is how carpal tunnel syndrome happens lah. All right. And lastly, we go to Decompression syndrome.
I do not even know how to pronounce that.
Yeah, fancy name lah. Okay, so actually these conditions have another name. It's called mummy's thumb.
Okay.
Yeah, but the name itself, it's very common among mummies lah.
Okay.
So what actually happens is the tendons at the outer of your wrist is inflamed due to overuse of the thumb. So this tendon is attached to your thumb lah, that control your thumb movement. So for mummies, they used to grab their children in an L-shaped grip, like this. Like they stretch their thumbs away from the fingers. So with this, you stretch your thumb too often, overuse of your thumb, leading to have inflammations here and causing you have pain, swelling, reducing the grip strength, like that lah.
Does it cause your thumb to like get stuck in a way and you cannot bend it as well?
Some people does, but if you feel stucking on your fingers, is most likely is another condition. It's called trigger finger.
Okay.
But usually if a pain's over here at the side of your thumb, usually is mummy's thumb lah. So there's another simple test you can test on yourself. Is first you grab your thumbs in your face, just like the picture here lah. You grab the thumb in the face, then you straighten your elbow.
Okay.
By straightening your elbow, try to bend your wrist towards the ground.
Okay.
Just like the photo here. So if you have the pain around here, at the side of the wrist or around your thumbs, consider positive.
Okay.
So this is a simple test you can test lah.
All right. I think when I gave birth to my son, I had this postnatal as well. I never knew what it was called or what condition this was, but it was a very painful situation, especially this number 3 sign, a catching or snapping feeling when you move your thumb. It was very, very difficult to work with when you have a newborn baby as well.
Yeah. So it's called mummy's thumb lah. Yeah.
Okay, now I know.
All right. So this will be the last conditions we're going to share today, which is the most common conditions that happens postnatal lah. And yeah, actually just now we already explained to the participants, which usually we suggest to start after 6 weeks of delivery. Then only you start the workout and the exercises. But some very simple yet important exercise can be done right after delivery. Even if C-section mommy, you also can join.
Okay.
It depends on what exercise you do.
Mm.
Right? And this is the general treatments that we can do for mummies, like medications, rest, heat and cold, braces, especially like mummy's thumb. There's a spleen for you actually to restrict the movement, to prevent you to overuse again lah. So there's braces for that. And activity modifications, posture corrections, massage, physiotherapy, injections, and surgery.
Okay.
So what actually physio can do to help mommy to manage their pain, right? The first is Indibala. So this is quite not saying new, but it's new to Malaysia lah.
Okay.
Aim to reduce the inflammations and reduce the muscle tensions by balancing the ions in our body, which is very effective in reduce the pain, inflammation, swellings, and even you can use to strengthen your muscles also.
Okay.
So this is how Indiba work. And postnatal exercise, it's very, very important for mummies. As I said, your muscle is become weak after after the delivery. So we need to strengthen it back to have a better core balance and strength to prevent further injury. And the next thing will be decompression therapy. So actually it's a traction bed that you lie on it. It will give a traction force on your spine to reduce the tensions, and it's very, very effective for these herniation patients, like the disc coming out. So it's very effective for those patients that, or even you have back pain, you also will be benefit from decompression therapy. Yeah. And the next thing will be pelvic floor training program. So actually a lot of mummies, they kind of ignore the importance of pelvic floor training. Pelvic floor is small muscles that down in our body that control our urine, and also it support some internal organs.
Okay, so this is the one where you actually do the Kegel exercises as well, isn't it?
Yeah, you know, right? Okay, it's like a lot of mummy that have urinary incontinence.
Yeah.
So by doing this, they need to strengthen back the muscles, let you to able control urines and support your organs lah, to prevent like uterine prolapse, things that might be more complicated to treat.
Okay.
All right. So I think it's the treatments that we provide. And just to refresh, things you should not do is by bend your trunk or twist your trunk, and all the crunches, sit up, plank, you should not do, and avoid repetitive wrist and hand movement that might cause you more prone to have carpal tunnel syndromes or mummy's thumb. And do not leave your baby with an L-shaped grip. Use your hand to support your baby's head when feeding. All right. Yes, I think this is our end of our common conditions talk, but we just give you some more information about our clinic in Bukit Jalil. So this is our contact, and you also can find us through Facebook or Instagram. If you have any questions or any inquiry, you can just call in and book an appointment if you want.
So how does physiotherapy actually help in postnatal pain? Or how effective is physiotherapy in helping postnatal pain?
So physiotherapists will be the one that teach all the postnatal exercise.
Okay.
So what you should do, what you should not do, more educations, and in a professional way lah, and how you engage your muscles, which part you should engage, which part should not,
Mhm.
And also by all the treatments that I explained just now, like Indiba is a very good treatments that we involve in our postnatal rehab.
Mhm.
We reduce the pain, and also somehow it might also can improve the pelvic floor muscles also.
Okay.
Even very deep muscles, like it can also have the effect in doing all these things.
Okay.
Yeah, and pelvic floor training also lah.
Okay. All right. So how long does recovery take if you actually go and get a physiotherapy done, you know?
All right, it depends on what conditions you have, I would say.
Okay.
If like it's low back pain, it also depends on it's a mechanical pure muscles problem, or it's other like this problem. If you have mummy's thumb, also it's a different kind of conditions already, but usually it takes around 6 to 10 weeks
Okay.
cover.
So about 3 months there.
Depends what conditions lah.
Okay.
Especially the sexual erectile will take longer time.
Okay. All right. So mummies are, you've been listening in throughout Xian's whole presentation. If you actually have a question, you're more than welcome to drop them in the chat box below. We will attend to that in just a bit. But I think, Xian, you've actually given us a very insightful session, because many of us, kind of just put it by the side. It's like, hey, normal only, this whole postnatal period, it comes with pain. But these are important information, ladies. So make sure you seek the right assistance to help you on this journey of recovery. Okay. So once again, we're taking your questions. Don't hesitate to type it in the chat box below. But for now, after hearing from Miss Xian, I think it's time for us to speak to someone who has personally experienced postnatal pain and turned to physiotherapy for relief. So let's welcome Mamanet's ambassador, radio announcer, actress, social media influencer, and personality, someone I'm proud to call my friend, Miss Kim Tan. Hey, Kim.
Hi, Mai. Hello, everyone. Oh, mamas. Good evenings.
Good evening. So you're a proud mummy of a year-plus-old little girl, right?
Yep. Yes. Already 1 year and so about 8 months.
It's going to be two very, very soon. Very exciting
fast,
time.
Very fast. No, she's very naughty.
Part and parcel of growing up, I guess. I think we were all very naughty at that point in time too, isn't it?
Yeah. Honestly, I hope she is very naughty then. Very normal. Just diam sit there. Wow, that one very scary.
Yeah, very true. So, Kim, tell us about your postnatal experience.
Okay, I'm the one, like what I just tell you all in the chat box. I'm the one lah who carrying baby with the wrong posture.
So did you actually injure yourself?
Yes, I did, especially my back pain.
Okay.
Super pain, and I'm really, really lucky to have my very professional physiotherapist, which is Miss Xian as well.
Okay.
Yeah, she said, okay, this one okay lah, confirm lah, you carry baby with a wrong posture lah. I said, yeah, and also because of your occupation I can sure you all the time also sit there, right? I say, yeah. So how is your table and your chair? I say, I don't dare to answer.
So
Sure,
how many of the problems that Xian actually walked us through did you experience yourself?
I think feels of it, like carrying baby, or even though the mama hands,
thumb.
the mama thumb also, wow, that was really super painful. Yeah, because actually before I gave birth, I also got back pain problem.
Okay.
Yeah, but not that serious. After I gave birth, I feel like my body is not my body anymore. And I will go and ask, the experience, like ask my mom, I feel that very pain. Is that normal? And my mom say, yeah, it's normal lah. Oh, mommy also like that one. Everybody also like that. That's why just now, when you guys say a very, very, very true things is, you need to seek for a right person. If you ask for a wrong person, then you will get something wrong also lah.
Correct.
So, right? Because they say it's normal, everyone also like that, not only you lah. So I was like, okay, yeah. Okay, so I need to get it through lah, right? Okay. But after a few weeks, I feel like, no lah. super pain until even sometimes I cannot walk, you know. I
Oh,
feel like,
wow.
yeah, it's really super pain until like for examples, we sit on the chair for maybe recording for 1 hour. Okay,
Correct.
after we have to stand up for a while. I feel like, oh, super hard. I feel like pain, really, really pain dekat belakang. I even don't know where is the painful part. I just feel like my body is pain, and that the all here is pain. Tak tahu macam mana. Kat mana pain tak tahu. Apa pain tak tahu, pain only. Yeah, that's why I need to go for physiotherapy. So lucky lah. Xian, she really explained very well. Yeah, she even asked me to do, okay, all this posture, this posture, this posture. Okay, cuba this, cuba this, cuba this. Okay, I know lah where is the problem. I said, oh my God. I'm really glad to have you.
So now 1 year, 8 months, right? You say your baby is 1 year, 8 months, right? 1 year, 8 months later, do you still feel that pain or have you completely recovered thanks to physiotherapy?
Honestly, haven't recovered
Fully.
100% yet.
Okay.
Yeah, because you know, now the COVID really, I also don't dare to go because got a very little girl with me. Yeah. So I only went for 1 or 2 times, but lucky Miss Xian did teach me some of the exercise that I can do at home.
Okay. So there are
Yeah.
methods that you can do at home.
Yes.
Okay,
Yes.
that's
Just the
interesting.
thing says you have to be rajin-rajin lah. Janganlah malas. Correct, Miss Xian?
Yes, correct.
So
Yeah.
Kim, for a person who has actually experienced it yourself, right? What is your advice to, other mommies here, watching you and taking in your experience and digesting it themselves? What would you like to tell them?
Don't cuba jadi doktor sendiri. You know, yeah, we always feel like okay lah, it's normal one lah, never mind lah, maybe after 1 week or 2 weeks it will be okay, we will recover by itself. Don't think about that. My back pain already few years still
Okay.
like that until I really go for physiotherapy. Okay, seek for a correct, the correct, you can get the correct suggestions, you can get the correct the advisor. Yeah, that is the most important thing.
Okay.
Just go. Don't
Absolutely.
leave it.
I think I would agree with Kim. Make sure you get the advice from the right person and make sure you go to the right person for relief as well, because we're Asians. We tend to self-medicate a lot. This auntie say, put this medicine, that auntie say, do this, that uncle say, do that. So we kind of do it a lot to ourselves. So just make sure you get the right information from the right people and go to the right people for relief as well. Yeah.
Yes, true.
Very important. Okay, so I think it's about time we take in some questions this evening. Let's see if our back end support have any questions for us. I know that going through the whole session, there I see. Okay, so we've got question one. I think like potong setengah, right? Like sekerat kat belakang I tak nampak. Okay,
kat belakang ada tak nampak dah.
Question one, Miss Xian. Ay, where's the question? Oh my goodness. What happened?
Oh, I think some of the participants also got questions, right?
Correct. Yeah, I saw just now. I know someone actually asked the question about that method you were teaching just now, Xian, right? The one where you lie down and you're trying to find out about your linear elbow, correct? That whole exercise.
Yeah.
Yeah. They wanted to know if you can do it when you're 39 weeks pregnant.
39 weeks means how many months?
Like almost going to pop.
Oh, you mean
10 months.
during pregnancy, is it?
Yeah.
Oh, I would say no need lah. Because
So
it's actually,
Yeah, go ahead.
it's actually a side effect after delivery, after all the stretch, and then you might have dissection recti. So it's no point you do during giving birth, during pregnancy.
Okay, so do it after. Okay, after you give birth,
Yeah,
then you
after
do it.
6 weeks.
After 6 weeks.
Yes.
So remember that.
Yeah.
All right. So looking at our question board, what is the importance of postnatal care? And what if we don't do postnatal care after giving birth?
Okay, so Importance of postnatal care is to prevent, it's more like a preventions to get all the complications that we have explained just now. Like your muscle is weak, if you're not strengthened, you have low back pain. Like your muscle is weak and your the stretch, all the muscle connective tissues being stretched and weakened, loss is elasticity. You just ignore like that for some times, you will become dissection recti.
Okay,
So
all right.
that's the importance to do lah.
That's the importance, yeah? Okay. Number 2, is it okay to carry our baby for a period of time? We're looking at 30 minutes, walking around after giving birth if the wound is still fresh.
Wow. It's also depends on individual. If you have bleeding, you should not do.
Okay.
But if your wound is fresh but it's no bleeding, should be okay. You can walk right after giving birth, is okay one.
Okay. Number 3, can I try self-test activity while this one we addressed it just now, right? 39 weeks pregnant. So let's not do any exercises like this or this test while you're pregnant. Let's do it 6 weeks post delivery. Okay. Question number 4, any treatment for carpal tunnel syndrome?
Yes. So usually we'll start with electrotherapy. It's machines that use electric current to reduce the inflammations, promote blood circulations, and improve the soft tissue healing. Then we use ultrasound, also speed up all the healing process, and with some mobilizations of your joints and some exercises. Exercise always very, very important for rehab lah.
Okay, that's very good. Very good answer. Number 5, can back pains lead to complications such as sciatica?
It might be. So, so during pregnancy, a lot of mummies tend to have an big tummy posture, like they arch their back a lot.
Correct.
So when you're in these positions for like 9 months plus, maybe after delivery, you still practice this posture, then you might putting yourself more stress on only few segments of the spine in your lower back. Then some of mommy will have this herniation, which the disc protruded out.
Yep.
Pressing on the nerve. Then you will have sciatica, which is the nerve symptoms down to your leg lah.
Okay. All right. Now I'm looking at the chat box right now. Although these questions are not on the board, there's one from Aini Najwa who's asking, is the right food taken after delivery affects the physical health of the mummy?
Oh, okay. So for us, we won't say any pantang lah, but actually it's the right questions to ask dietitians than the physiotherapists, I would say.
Fair enough. Fair enough. Now I'm looking at what you were saying just now, right? And I'm just thinking, we're Asians and we have a lot of pantang after we give birth, right? So how does the traditional method of recovering merge with the modern method of recovering, like physiotherapy? You know, do they like complement each other, or is there like a misalignment as well?
Well, I would say pantang there got the reason lah. You cannot take cold food like that. But pantang like some others, how to say, you cannot wash your body. Some maybe they say like that, but I would say it's still okay. But yeah, it depends. Some mama say you should not do. Some is okay. But for Western else, we'll say it's okay.
Okay. The reason I asked you this is because I think you've heard of, you know, how post-pregnancy mothers would do like bengkong, right? Because they want to make sure their body, their figure is all managed, right? So when you bengkong, it's actually very, very tight, right? But here you are telling us not to do any exercises or not to do anything to do with our bellies. 6 weeks, within 6 weeks, the first 6 weeks of giving birth, right? So how do we explain that though?
I'm not sure your bengkong, is that like a brace?
Yes.
Brace. Actually, you can have that. It's one of the preventions to have the dissection recti lah.
Okay. So it actually helps lah in the recovery.
It helps.
Okay, so that's a very interesting thing. All right. So I think we've come to the end of Xian and Kim's session this evening. Xian, anything else you'd like to tell our viewers?
I think that's all, but just if there's mummies listening to our talk, hope you take care of yourself, along with the COVID lah. And I know it's a very hard time. And hope you are we're all doing well. And if you need any consultations, just feel free to call in and get appointments lah. Yeah.
All right. Thank you, Zil. Thank you so much, Stan, for actually sharing your point of view and giving us very important information that we need in terms of postnatal recovery. Thank you so much, Kim, for sharing your experience. At least other mommies out there know that they're not alone, that other mommies go through this as well. So thank you so much, ladies,